Assalamu alaikum, myself Mouaz Rafiq. I'm from group C1. The topic of today's presentation is the pregnancy termination in a mare with a hydroallantois. So let's start with the background and the significance. Hydroallantois is the abnormal accumulation of the allantoic fluid in a allantoic cavity. The normal volume of allantoic fluid is 15 to 20 liters, but in case of hydroallantois it reaches up to 80 to 200 liters. Hydroallantois occur more commonly than the hydroamnios. For the reason of hydroallantois, there is a placental dysfunction which is mainly due to the less number of the placentomes which are responsible for the fluid exchange between them and the fetus. Clinical signs include sudden abdominal enlargement, dyspnea, anorexia, recumbency, and reduced movement. All of these are because of the because of the pressure exerted by the allantoic fluid onto the organ. For the clinical case description, the patient was 14-year-old American quarter horse. It was presented on the 301 day of the gestation. It has premature lactation, Caslix presentation, size of mare abdomen increased dramatically with noticeable distension. Caslix presentation is mainly the surgical procedure in which there is suture on the dorsal valvular lips. It is done to prevent the entering of air and feces into the vagina. The owner told about the medical history that the wear was on the treatment of the placentitis. They were using trimethoprim, metronidazole, pyrocoxib, and altrogest. For a reproductive history, the mare parturited 5 times. Four of these foal were live, and one was the stillbirth. For the clinical findings, the mare was bright, alert, responsive, and had the normal vitals. Its abdomen was distended and was symmetrical on the both sides. Skin was tightened. There is a dyspnea which is due to the pressure exerted by the amniotic fluid onto the organs. For the transrectal palpation, the uterus was enlarged, fluid-filled, and it was cranially displaced because of the weight of the fluid. For the ultrasonographic examination, there is a large allantoic fluid. Fetus was not visualized as there is a light amount of fluid, and the fluid was anemic. So here we have the pictures from the case study. You can see here the ventral distension of the abdomen. In the other picture, there is a lateral distension of the abdomen on the both sides. For the diagnostic approach, diagnosis was based on history, clinical sign, transrectal palpation, and ultrasonographic palpation. Main diagnostic signs were markedly abdominal distension, transrectal palpation, and the ultrasonographic. And ultrasonography, there is a large volume of anechoic fluid. Fetus was not visible as fluid is anechoic and it is large in number, so the fetus was not visible. For the differential diagnosis, we have hydroamnios. Hydroamnios occur it has gradual onset. It occur in the earlier days of the pregnancy, not in the later days of the pregnancy. In this condition, the fetus is visible, but in our case, there is no visible sign of the fetus. Abdominal hernia. In abdominal hernia, there is soft skin in the hernial on the hernial part, but in our case, there is a tight skin all over the abdomen. Ascites is related to systemic illness, but our mare was completely fine, but just having the hydroallantois. Twin pregnancies, if there was twin pregnancies, we can see them in the ultrasonography, but in our case, there is no sign visualized of the fetus. For the treatment, they decided to terminate the pregnancy of the mare to prevent its life and future fertility. To systemically support the mare, they gave 1 liter of the ringaductate intravenously. The Caslix sutures were removed. To drain the fluid from the allantoic cavity, they used 21 inches Foley's catheter and removed about 45.4 liters of the allantoic fluid in 2.5 hours to reduce the chance of the hypovolemic shock. To induce the delivery, they gave 60 units of the oxytocin in 1 liter saline. The fetus was in malposition, that was the dog-sitting posture, and they identified it and correct manually. For muscle relaxation, they gave dimetonidine and the ketamine. All of this came in a result of the stillborn fetus, which was 4 to 6 weeks premature. The outcome of the treatment was satisfactory. The mare recovered smoothly and it had expelled its placenta within the 3 hours. The owner was advised to give the rest to the mare for the 2 estrus cycle and the rebreed in next season via artificial insemination. In next season, the mare gave the healthy filly. after uncomplicated pasteurization. Overall prognosis was the excellent. So that's for the presentation. Thank you for your attention.